Welcome everyone. We're here today to talk about urinary tract infections, and here today I have one of our physicians and I'll ask him to introduce himself.
Hi everyone, my name is Dr. Pham and I am an infectious disease physician here at Valley Medical Center.
Great, thank you for being here. Let's start with our first question. What is a urinary tract infection or UTI and what causes it?
So a urinary tract infection or UTI is, as the name suggests, an infection within the urinary tract. Typically is caused by a bacteria or even a fungus that makes its way into your urinary tract and cause an infection.
What are the most common symptoms of a UTI?
Most commonly, when you have a UTI, you might experience something called dysuria or burning when you have urination. You can also have bladder pain or pain in the lower part of your abdomen. You can also have more frequent urination as well. And sometimes in severe cases, you can have back pain and fever.
Are UTIs more common in certain populations and why?
So UTIs affect both men and women, but most commonly, they will affect women more often just because they have a shorter urethra, which makes them predisposed to getting infections. And also, postmenopausal women are more frequently going to have UTIs just because they have a atrophied vaginal wall or shrinkage of the vaginal wall, which prevents that physical barrier from protecting you against UTIs.
How do you diagnose a UTI?
UTI is typically diagnosed with the clinical symptoms that we just discussed, and then also typically your urine will be tested and certain markers of infection will be noted in there, such as your white blood cell count, and if that's elevated, sometimes that will be sent out to culture to see what type of bacteria or fungus is causing that type of infection.
What are some ways to reduce your risk of developing a UTI?
So some of the ways you can reduce your risk for getting UTI is to stay mostly hydrated. That's the most important thing, is that you can flush out that bacteria so it doesn't cause an infection. Some other things you can do are taking cranberry juice or supplements. There's also a supplement called D-mannose that has been shown to be somewhat effective. And then lastly, if you're a postmenopausal woman, you can use vaginal estrogen to help strengthen that vaginal wall to prevent the bacteria from entering into the urinary tract and causing an infection.
What is the most effective treatment for UTIs?
Typically, we treat UTIs with a combination of antibiotics, and sometimes that's more tailored to what exactly is causing the infection that's growing in the urine.
Are there any risks associated with untreated UTIs?
So it's important to get your urinary tract infection treated because left untreated, it can kind of ascend its way from your bladder and go up into your kidneys and cause an infection of your kidneys called pyelonephritis. And with that, it can also enter into your bloodstream. So it is important to get your urinary tract infections treated appropriately.
When should you seek care for a UTI and who should you see?
So if you believe you have symptoms of a UTI, the first person you should reach out to is your primary care provider, who can appropriately test your urine and prescribe the right treatment for you. If you continue to have recurrent UTIs or the infection keeps coming back, you might want to see a urologist who can assess to see if you have any anatomical abnormalities that might be predisposing you to these UTIs, such as you have any kidney stones or things like that. And if it is an infection that is hard to treat or a bacteria that has a lot of resistance, then at that point you might want to see an infectious disease physician.
Thank you for answering our questions today, Dr. Pham. And for those of you watching, we invite you to look at our website. The link will be below.